We call it wet procedure. That makes a fat cell to be removed much easier. And also patient have much less bruising because of epinephrine we have in this anesthesia. At this point, we are trying to give her some local anesthesia. We're going to numb the skin. That's why we're going to make our incision. To put the anesthesia in, we call it tumescent. Now we're going to do point of entries. Is it numb?
Yeah.
Very, very small incision. Would heal very nicely. And you would hardly able to see it after about a couple of months. These incisions are very small. That's the point of entry. That's what we put the cannulas for liposuction and also for laser. And also we put the cannula in through this hole to infuse tumescent medication to numb the area. This is very safe. As you see, the tip is blunt. And there is no danger of puncturing patients' internal cavity or lungs or anything.
Higher. Higher.
We pump it in very slowly.
Perfect. Thank you.
As you see, it's going in. After we finish this, we wait about 20 minutes to half an hour for anesthesia to take effect, and also the epinephrine, we put this to constrict the blood vessels. Then we would have less bruising and less bleeding after the surgery. In reality, the biggest difference between this one and regular liposuction is patients, they recover much faster, and also they have much less downtime, and the amount of bruising is far, far less. Also, we use much smaller equipment when we do this versus regular old-fashioned liposuction. Okay, what I'm doing right now, we call this grader. We are trying to disrupt the fat, make it ready for suction. Patient doesn't feel anything at all because it's all numb. We know it's numb because it's blanching. If you see the skin is blanching, that means it's numb. This is a wet procedure. We call it wet procedure. But the good thing about it is patient is not out. They can get out of here, go home, watch TV, and do what they want to do. A lot of patients, they go out to dinner at night. They can go shopping the next day. And as a matter of fact, she was requesting to come to work tomorrow, but I'm going to give her a day off. We picked a proper cannula. As you see, the cannula is very thin. We connect it to the suction. We're ready to go. Yep. Okay. As you see, the fat is coming out through the tube. Sure. Patients, they love to see it. The fat is going out of their body, in the tube, in the jar. How are we doing, Jasmine?
Good.
Patient is listening to her iPod. She is not feeling anything. We call this Brazilian style, what we are doing right now, to get the fat out of there. That gives the butt good contour. We monitor patient's blood pressure, pulse, and respiration with that machine over there. They're constantly under control. We talk to the patient.